All right, so upper left quadrant pain. So if we kind of do a cross here, we do a line right from our chin down to our pubic bone, and then right across this way, right through our belly button. That's our landmarks here. I'm going to put up a picture for you guys so you can see here. So we have our upper left quadrant here. On my side, I may be a mirror image, so it may look different, but this is my upper left quadrant. Upper right, lower left, lower right, and it's right through the umbilical. And so when we look at the upper left, a couple things I want to highlight in the anatomy here. And again, if you're on Instagram, you won't have the screen share. Head over to youtube.com/justinhealth to see. So upper left quadrant pain, you're going to see most of the stomach is in this area. Now, upper right quadrant pain, people mainly think of that as like gallbladder or liver pain. You can see the tail end of the stomach, right? Tail end of that stomach into the duodenum, the first part of the small intestine, could hit that upper right-hand quadrant. Most people think of the upper right quadrant as just going to be gallbladder, but you could have, just when you cross that line there in the tail middle, you could have a little bit of the duodenum, first part of the small intestine, and a little bit of your end of your stomach. And then, of course, once you go to the lower left, once you go to the tail ends where the iliac bones are, we're thinking more colon. We're thinking more descending, right? Leaves left. So that's your descending. It leaves on the left. And then on the right side, that's going to be where your appendix is, right around your hip. On the hip bone area, more of the colon. And then in the middle area, that's where all your intestines are going to be. So when we see that upper left-hand quadrant pain, we're focusing on the stomach. Now, why do you have stomach pain? Gastritis, okay? That's just stomach inflammation. The tissue is thin. The tissue is inflamed. A lot of times with gastritis, there may be that worn down gut lining. A lot of times there may be actually low stomach acid with gastritis, which is interesting, right? Because people think of gastritis, they think lots of acid, lots of irritation. There has to be a lot of acid going on, right? A lot of times that may not be the case. We may have low levels of stomach acid. And what happens? The food ferments, it putrefies, it rancidifies, and essentially rots in your stomach. And that rotting can create its own acids. Plus, when we don't have adequate levels of stomach acid, that esophageal sphincter, which is the sphincter that goes right from the top part of the stomach into the esophagus, that has to tighten. If that sphincter does not tighten, then a lot of that acid can rise up. Guess what one of the big feedback signals for that esophageal sphincter to tighten? Guess what it is? Think right now for a second. Put your comments down below. It's actually acid. So we need good acid levels to actually get that esophageal sphincter to work. That's super important. And then once we have that good acid levels, the good acid levels activate enzymes. Enzymes are pH specific. So if we don't have good pH, that nice low pH around 2 to 3, we're not going to be able to activate our proteolytic enzymes. So that's our pepsin, pepsinogen to pepsin. Our proteolytic enzymes are going to be pH sensitive. Now, when we have that gut lining raw, there also can be bacterial overgrowth. You could run or see like a SIBO test, like especially like in the first 10 or less 20 to 30 minutes or so. If we see elevated gases, there could be bacterial overgrowth in the stomach, right? And that could be from H. pylori.